We don't really have precise answers to those questions for this particular coronavirus, but we do know from other coronaviruses like the original 2003 SARS, MERS, Middle East Respiratory Syndrome coronavirus, and other respiratory viruses in general that there are a lot of different factors that determine how sick we get when we're infected. Some of them are related just to the amount of replication that the virus makes in our respiratory tract, how much replication occurs in our lungs, but also on our immune response. Probably one of the important reasons why older individuals are at higher risk is their immune responses change over time. Our immune responses are very complex, and they're basically two phases. The first phase we call the innate immune response is a kind of response that doesn't depend on us having seen through past infection the same kind of virus or other pathogen. It's a general response that occurs in response to many different viruses and bacteria. And that response tends to control the infection to some extent until the second phase of our immune response can kick in. That's called the adaptive immune response. And that's the part of the immune response when we make specific antibodies and certain kinds of cells that can attack the virus or infected cells in our body very specifically, and also that induce a form of memory where those antibodies and those cells will be in our body for a long time, and if we're re-exposed to that same virus, they can protect us very quickly then. But the main problems I think that we're seeing with differences in severity are related to that first innate response. And the innate response is tightly regulated because if we over-respond to infectious disease like SARS coronavirus, that innate response can harm our body. The inflammation that occurs is very harmful, and a lot of the most severe viral diseases that we know of, for example, Ebola virus, the main damage that kills people is an overreaction of that innate immune response. It leads to something we call a cytokine storm, where certain chemicals produced in the area of the body that is infected, in the case of coronavirus, the respiratory tract, those chemicals get distributed through the body and they affect many different organs. And what we're starting to see with this coronavirus is that it's not just a respiratory disease when people get extremely ill. It starts to affect many other organs and systems in the body. And that's probably due to the overproduction of these cytokines and then dysfunction that occurs in many different systems of our body. So for example, a lot of people are experiencing gastrointestinal problems, cardiac problems. Those may not be because the virus is replicating in those locations, although there has been virus detected, for example, in the stool of a few patients. But a lot of the damage is probably due to this overreaction of our innate immune response. And as we age as humans, the tight regulation of these responses to give us just the right amount of response to control the infection, but not too much response to damage our own bodies, that regulation seems to not be as precise as we get older. And so part of the reason that older people are at higher risk may be due to poor regulation of that immune response. Some parts of our immunity just don't function as well when we get older. That may be part of it. But a lot of it is probably related to the indirect response of our body to the virus replicating, not so much to the virus itself causing direct damage.